Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Today, I'm very excited to talk with our guest, and we'll be talking about orthopedics and pain management. With the summer coming on and we're moving around more, and after COVID, everybody's kind of out there. We're noticing pains, it hurts. So today I welcome Dr. David Lynn. He's a board certified and practices general orthopedics with special interests in fracture management, arthroscopy, cartilage preservation, and joint replacement. He has extensive experience in sports medicine and has worked as an assistant team physician to several professional teams in Houston, the Texans, Astros, Rockets, and Dynamo, as well as Rice University and HISD. Dr. Lynn also has knowledge with expertise with orthopedic injuries sustained by military personnel. Welcome, Dr. Lynn. How are you today?
No, I'm doing very well, Donna. Thank you for having me.
Well, I'm glad to have you on today because a lot of times when we think about orthopedics, we think about fractures or knee replacement, rotary cuffs, or those kind of things. And there's a whole lot more than just surgery that goes into orthopedics.
Oh, absolutely. I mean, part of it is also maintaining health and joint health, musculoskeletal health. So a lot of our practice is also preventative medicine, as well as trying to keep them staying active. Last resort is surgery, but that's certainly not all encompassing in what we do.
So I'm hearing a lot and seeing a lot, COVID kind of made us sedentary.
No, absolutely.
And, we've gained a few pounds and those joints are getting a lot more pressure and stuff. So we're getting a lot more pain. When does pain become something that we need to worry about or treat, or, maybe I've started exercising and now my knees or hips hurt when I walk? When do I need to see you?
Sure. Well, certainly pain is part of our natural response to tell us that we need to slow down. And so a lot of that really depends on the circumstances or onset of pain. If it comes about after an acute injury, then certainly we think about, did you break anything or did something strain? If it comes about from doing something after you've been sedentary, then that can come from overuse. I think a lot of, rule of thumb I like to say is does it go away after you rest? Typically any of those kind of minor sprains and aches can, just giving a period of time, whether it's several hours to a day, if it gets better, that's usually encouraging. Although if it certainly gets to the point where it's getting worse, or if you have things like what I like to call mechanical symptoms, if you're clicking, catching, things are kind of moving, rattling around, you feel like something's moving or rattling around in there, those are the times where I would maybe do a little more workup. But a lot of times just rest, the simple stuff that everyone knows about, ice, that's always a good first line treatment. And if there's any concerns, then come and see us.
Okay. So let's take the knees.
Mm-hmm.
Somebody that has knee pain and it gets worse when they exercise or they become uncomfortable with their standing, maybe some swelling and stuff. What are some of the treatment options available nowadays?
Mm-hmm. So yeah, a lot of the, I always like to tell folks start simple and work our way up. So little things like rest, ice, heat too. It depends on which one works better. Any over-the-counter medications. Then for other modalities, for us, there's potentially bracing, injections, things like that. So.
Okay. And then do you treat kids also? In what age group do you treat?
I do treat kids. I mean, I have experience in treating. Usually I would treat kids that are kind of the walking age, like preschool. So, but, we can see infants if we need to rule out any kind of things. But those I would typically send to the specialists who have more extensive knowledge in that. So
I'm just thinking now our kids are playing softball, baseball, football, all these things.
Oh, no, absolutely. Yeah.
Yeah, and I actually have a granddaughter that pitches softball.
Right. Yeah.
And she complains about her shoulder a lot.
Yeah, no, absolutely. I mean, with kids now becoming more active and all these specializations is sports, and here we're in Houston, everything is year round. All the outdoor sports, definitely we get a lot of kids who have these kind of overuse type of injuries that we would normally think would be in adults or more elite players. So.
Yeah. So, how do we prevent some of this? Because I worry about long term.
Sure. I think definitely making sure you have a period of rest. One thing that always concerns me is when these kids are doing year-round sports. I grew up in the Northeast, and changing sports was just kind of natural. I mean, your fall sport was football, and then you move to an indoor sport, wrestling, basketball, and then you're back to playing baseball. And so just being varied in your sports, can do a lot to prevent, because you're using different muscle groups, you're allowing other muscles to rest. So I think trying to, an athlete is an athlete, and any kind of sport will help them. I think also maintaining range of motion and strength. A lot of times, when you do one thing over and over again, you start to get stiff in certain areas. You overwork muscles. So maximizing those, but also don't forget rest. I mean, I think having an off season is always a good. People undervalue that a lot. They think that if they're not practicing, somebody else is, and so.
Right. And you see these kids, hind catcher, pitcher, all the team playing the same position and playing 3 or 4 games back to back.
Right. No, for sure. I mean, there's all these tournament games, and I think but things like nowadays with strict pitch counts, I mean, I think that's all a good thing. That sort of takes the decision making out of a lot of the adults, and I think just being aware of the injuries, I think that's come a long way. Hopefully other sports will kind of follow along. I mean, you have football that big worry about head injuries, but there's still a lot of overuse to, basketball and volleyball players, the jumping injuries, maintaining knee health. So I think just awareness is important, and I think if everyone's on the same page in terms of not overdoing it, I think that's a good thing.
And I would think if they continue to complain or have swelling or anything like that, just to be checked out would be a good thing.
Oh yeah, absolutely. I mean, like I said, definitely there's at risk for overuse, and I think people are still under the mantra of no pain, no gain. But I think that definitely can be a warning sign is to not ignore it and ensure that you are maintaining your health. And I think people are worried about going to the doctor sometimes because that they're worried about not being able to play. But I also tell folks, the professionals are the same way. I mean, they rest even though they're making millions of dollars and have lots at stake. And so for them, it's just as important. So for the lower level players or even the elite lower level players, I mean, rest is just as important. So.
Good. And then we have us older guys who get this little thing like we're 13 again and we're going to go out there and play baseball. People are doing the volleyball and baseball and all this stuff, and pain happens after that.
Oh, no doubt. Yeah, we definitely get a lot of the weekend warrior types, the tendon strains and ruptures from trying to compete with your teenagers. I would definitely encourage them to be healthy and do those kind of active things, but also to sort of take it slow. I think, for people who don't dive for the balls that you might normally do, but like I said, or know your limits, listen to your body. For those older weekend warrior types, I usually really tell them just be aware of your body. You're not going to recover the way you are like a 17-year-old, but also you got to maintain yourself. Just like older cars, you need to change the oil a little more frequently. You got to make sure the treads in your tires are doing well. So same thing with the older crowd or anyone in general, but more so for the older crowd, making sure your strength is maximized, your joints are range of motion, get all the core strength and it doesn't take a lot. It doesn't mean you have to live at Lifetime Fitness for hours on end. Sometimes it's 10, 15 minutes of doing some strengthening can come a long way towards doing the other things you want to do. So.
Okay. So sometimes surgery is necessary, and we got to do it.
Sure.
How do we know when it's time for, let's say, a rotator cuff or what's the indications? When is it time?
Sure. Most often in orthopedics, everything it's a last resort. So there are certainly things that are more urgent, such as fractures. But for a lot of these musculotendinous injuries, we can definitely try a period of non-operative treatments, medications, things like that. So you mentioned rotator cuff. People can function very well with a rotator cuff tear. So that's one of those where I definitely would encourage people to exhaust all options. But then if it really just comes down, how much is it bothering them and how does it affect their lives? And for everyone, that's different. I mean, for those that are more sedentary, they may find that, you know what, I have shoulder pain and I'm okay with that. But for those that are more active, if it affects their golf game or if it affects them being able to lift their child, if, kind of everyone's different. So you fill in the blank and if they're not able to do those things and they want to, then that would be a reason to do surgery. And for everyone, it's different. And
Well, it sounds like you work with the patient on lifestyle quality in order to make a decision of what needs to be done, which is kind of nice.
Oh, absolutely. I mean, everyone's different. I mean, everyone has different wants and needs in terms of what they're happy with, and certainly, our goal is to get them to where they're happy, and sometimes that involves surgery, and sometimes it doesn't, and everyone is different, and so we tailor it to how their lifestyle is, for sure.
So you talk about cartilage preservation.
Mm-hmm.
How do we preserve our cartilage?
Well, I mean, certainly, cartilage is kind of like brain cells. So, we only have what we have when we're born, and if it's injured, then there really is no healing that. Our body, when it is injured, our body basically lays down scar tissue, which can still function, but it's not as durable as cartilage. It's like kind of duct taping over a hole in your wall, and it'll work and keeping the rain out, but it's not really durable like regular drywall, and so we want to try and preserve what we have, and so mainly trying to maintain the strength around our muscles, so they do a good job of protecting our joint pains that would put us at risk, making sure we get the proper rest, maintaining good nutrition, part of the cartilage also, the fluid around it, has an additive protective effect, but our body also has enzymes and cytokines that also break down cartilage. So and some of the foods we eat have good protective antioxidants that can potentially protect the joint. I mean, there's no one food that is best for joint, but I think it's also important to maintain a healthy diet. A lot of the fruits and vegetables we eat have protective effects, not just for the joint but our entire body.
Okay. That eating healthy falls into almost every category.
Oh, absolutely. Absolutely.
So I want to brush because joint replacement, knee replacement, those kind of things, you used to hear, oh my God, I don't want to do this. It takes forever. I'm in the hospital a week,
right.
Everything else. That has changed drastically, I understand.
Oh, for sure. I mean, I think, we weren't that far off from when people would stay in the hospital 3 to 5 days, if not longer. And I think as we're progressing, we're realizing a lot of these things that we're doing in the hospital, we're actually causing them ourselves. I mean, putting them, used to be giving them a Foley or having, giving them, excess pain medications, or a lot of these things, they're staying in the hospital and really not really a lot of benefit. So these days, the total joint replacement stays typically one night. I mean, we even send people home the same day, because I think they do a lot better in a familiar environment. They getting up and around, and I think we found that they actually do better, and a lot of these things that we're worried about that we keep them in the hospital really hasn't been the case, and so that has changed a lot. I think the profile of the typical person that gets a total joint, I mean, used to be people would tell me stories about they saw a doctor and they told them they're too old or too young or too old or too big, or so I don't think that the people who are getting total joints are getting younger and younger and more active. It certainly has its benefits, and I think it's just like the other conditions. It's really based on their lifestyle, and there is no cutoff age or cutoff weight that says they are not eligible for it. And
okay, so a lot of us are walking around, getting older, and having more pain, arthritis, all of this stuff coming in. Is there a time when we should just start a baseline with an orthopedic to kind of make sure our joints are working right and that kind of thing?
Yeah, I mean, we certainly, I don't. We're certainly there to kind of help with those kind of programs, and there are we definitely see our fair share of folks who want to just make sure that what they're doing is safe, and so certainly primary care docs have they have experience with musculoskeletal issues as well, and so but I think if they want to start a program, I think that's reasonable. I mean, sometimes there are things that we can identify that may need a little work before they want to start a program. If their joints or certain muscle groups are deficient, maybe work on that. That could be a reason why they can't seem to quite get off the ground with certain things that they want to do. And so it's, I think there's always, we don't necessarily, you don't have to wait till you need surgery. And like you mentioned, some people think that by going to a surgeon, I automatically need surgery, but there's definitely a lot of other modalities we can do to help with preventative care as well. And not just fixing things.
Awesome. I think that's great information to know, because I hear a lot of people, and I do it myself. Oh, I don't want to go because I'm going to end up having surgery,
Right.
and we end up doing more harm to ourselves than having a baseline and coming and seeing you and trying some of the other alternatives out there, because there are a lot now. So, Dr. Lynn, where are you located?
We have multiple locations. In addition to Sugar Land near the Oak Bend, we have offices in the Greater Heights area as well as Katy. We even have our office up in Kingwood where we cover. But so we, myself and my partners and orthopedic associates, we have multiple offices that encompass. But I focus mainly on the west side, down by the Sugar Land locations.
Well, we're extremely happy to have you at Oak Bend. And we hear great compliments from our patients that get to see you. So I would suggest anyone that needs to see an orthopedic, Dr. Lynn is very good with his patients. Is there anything else you'd like to tell us that we need to know, Dr. Lynn?
Oh, I think we pretty much cut on the highlights. Yeah, with the weather becoming nicer, it's certainly important to maintain to be active. I think certainly our goal is to keep people active and to do that safely. And for those where any kind of aches and pains prevent that, we certainly we trained to maintain that and to help people when they can in that regards.
Okay, great. Well, Dr. Lynn, I want to thank you for joining us today. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.